Good afternoon. My name is Karen Koenemann, and I am the Pitkin County Public Health Director. Thank you for giving me the opportunity today to talk to you a little bit further about public health and winter planning for Pitkin County. So I wanted to start out today just talking a little bit about the juxtaposition between public health and economic and social recovery. I know at times these seem like they're oppositional, that public health is a barrier to economic or social recovery, and that economic success might be a barrier to public health. But to that end, I believe that public health is actually the route to economic and social recovery, and it's not the barrier. Really, there's no way around it. Getting the economy back on track means controlling the pandemic. There are no shortcuts. Putting people's lives at risk and wishing the virus away are not going to produce magical economic recovery. Forbes just recently did a study in which they really found some data that supports this concept, and that all pain and no gain, that risking the public's health does not lead to faster economic recovery. For example, in states that took the riskiest public health approach, often saw cases surge, a growing share of people struggling to pay their rent. The share of renters either not paying or deferring their rent was 1.6 percentage points higher after reopening than before. And while there was no change in states that proceeded more cautiously. And the more cautious reopening approach was associated with greater job gains. The share of people with a job was 2 percentage points higher after reopening than before in states with longer stay-at-home orders, while it was only 0.5 percentage points greater in states with shorter stay-at-home orders. As virtually all states have left their stay-at-home orders in the rearview mirror, it becomes increasingly clear that putting people's health at risk did not accelerate the economic recovery in states that reopened faster. And to greater effect of this, some data is actually showing that fear of COVID-19 itself, not the public health orders, are actually the primary cause of reduced economic activity in certain communities. And this graph shows consumer spending trends between Colorado and New Mexico in relation to their public health stay-at-home orders and then the reopening. So this shows the spending patterns in Colorado and New Mexico were nearly identical in February through May, despite the fact that Colorado began reopening selected businesses on May 1st and New Mexico on May 16th. We also find little or no impact of earlier reopenings on employment rates. These findings show that it's the fear of COVID-19 itself, not the public health orders restricting business activity, that are the primary cause of reduced economic activity and job loss. And to go on to our local story, this was actually in the Aspen Times today, October 25th. And interestingly, observers of local business scene had thought that the onset of the pandemic, they would be counting the increasingly number of empty storefronts by fall off season where we are today. But just like most things in COVID, it's been the opposite. And that was Carolyn Zachariason's article today. In addition, upon interviewing some of the restaurateurs in Aspen, Jimmy Yeager stated one of the things we did was heavily focus on what are the things that are stressing businesses, and certainty causes a level of anxiety, he said. We reduce our hours, our staff is stronger, and we are happier, more profitable, and less stressed. I'm actually more optimistic than I have been for years. How weird is that? And I know that's just one example, but I think it is indicative of what we've been seeing locally, that retail businesses are doing well, restaurants are doing much better than anticipated, and we're seeing a big surge in real estate within Pitkin County. So really, to underpin that public health is really this route, that if we can get public health right, we can really get to a faster economic recovery and social recovery. And that once we have SARS-CoV-2 under control, we'll see further economic and social recovery within our community. So that leads me to really where we are today with public health. And recent COVID-19 models that the state's been putting out are actually fairly alarming right now. We are at a critical moment to change the course of our future. And knowing that, in particular in Pitkin County, we're in an off season, we really want to tamp down the spread of SARS-CoV-2 through the community at this point, because we know as we start to move into holiday seasons and the winter, all the great things that come with our winter season, that the risk just increases in all of those cases because people are interacting more, and we're just going to see more people within our community itself. So now is really the time, both nationally, state, and local, to really consider what we can do, again, to reduce transmission spread and the chains of transmission within our community. So this is the bullet points I have here are actually based on some recent state modeling that just came out this week. And just to kind of frame up modeling in general, George Bach said all models are wrong, but some models are useful. And really to paint the picture of why we look at models, the purpose of modeling isn't to predict the future. It's not a crystal ball, but it's rather to give us scenarios for the future so that policymakers can change the course of that future and individuals can change the course of that future with their behavior. So when we look at what we're predicting for the next few months, it's a little, as I said, a little alarming. We're seeing hospitalizations increase across the whole state. Avoiding challenging peaks in infections and hospital demand over the next 3 months will actually require a substantial increase in transmission control. And transmission control can include anything such as wearing a face mask or social distancing or doing other measures, public health measures that can actually reduce that, that transmission of disease. The window to improve transmission control is over the next several weeks, and that's what the state is really saying, is that now's the time. On our current trajectory, Colorado will exceed the April peak in hospitalizations by approximately November 15th, and ICU capacity by January. And the magnitude and timing of reductions in transmission will determine the severity of COVID-19 in Colorado in the months ahead. In addition, we just have been following what's been happening in Utah, our neighbor, and Utah is seeing such a surge in hospitalizations right now, overwhelming their ICU, that they're looking at crisis standards of care in the next week, which means that they're ultimately triaging patients and determining who is going to get care and who might not get as advanced care. And that's pretty alarming to be thinking about crisis standards of care and implementing those crisis standards of care in their hospitals, just because they're seeing so much overwhelm right now. And I think it's just a good example for us of what we don't want to get to in Colorado. So what's giving us concern locally are a couple different things. You can see here in our epidemiological curve and case demographic information, this is our incident rate. So just a reminder that our incidence rate is the number of cases per 100,000 people. It's been up in the last 14 days by 11.25. And you can also see that there are two lines on this graph. The lower line is the safer level at home threshold, and then the orange one is our safer level at level 3 threshold. And right now we've been at the safer level 2 threshold, but you can see that our epi curve is peaking up over that safer level at 3 threshold, which is when we would have to implement, per the state dial, additional kinds of ways to increase social distancing, which can include capacity limits. So capacity limits at a restaurant or other such businesses. So we just really want to be cognizant that we've been over that safer level 3 threshold for a number of days now, and that is definitely causing us concern. In addition, we've had a higher positivity rate. Our positivity rate over the last 14 days is gone over 5%. We always want to keep it under 5%. So it was 5.2% in the last 14 days. And in the last 7 days, it's actually been 6.1%. And then yesterday, just a point in time, it was 21.7%. So we've definitely seen an increase in our positivity rate and are continuing to see growth there. The other thing that is causing us concern is our outbreaks. In Pitkin County, We currently have 10 outbreaks that we're managing. That's the most number of outbreaks we've ever had to manage at one time since the pandemic began, which is also just an indicator of the amount of spread that's happening in the community that we have outbreaks. And that's, again, 2 or more cases within a 14-day period in a certain location. So we are really concerned about the number of outbreaks that are happening right now in Pitkin County. The other thing that is giving us pause is that our effective reproductive number is well above 1. And you can see here, we're lumped into the Central Mountains. So on 9/24, our RE was 0.98, which is good. It was below the 1 that we want it to be. Again, this is the number of folks that are well, I'll explain a little bit more about the RE1 in a second, but you can see that on October 8th, we moved up to 1.37 for our RE. We have one of the highest REs in the state right now. And that jump, that huge kind of increase from 0.97 to 1.37 is really an indicator that we're seeing really rapid growth really quickly over time. So the spikes are sharp. They're going up very steeply. And that's also an indicator that we look at to see how fast we're moving into higher disease transmission rates. So the effective reproductive number is the number of people in a population who can be affected by an individual at any specific time. It changes as the population becomes immunized, either by individual immunity following infection or by vaccination, which obviously we don't have yet. So it's really just by infection right now in our community. It's the number of affected, REs affected by the number of people with infection and the number of susceptibles with whom infected people are in contact of. So people's behavior, like social distancing, can really affect the RE. So that's, again, just another place where we are pausing and have a bit of concern. So that leads us to this concept of really planning for the winter season. And we really do want to have a successful winter season, and all the things that Pitkin County has to offer for our local community as well as for visitors. And in order to really get there, to have a season in which people can participate in winter activities and that we can have, a thriving social kind of enterprise and thriving economic vitality, it really, again, we are at such a critical point to get there. And if you look at this timeline, we just did we took our original epi curve, or our past epi curve. This data was gathered as of October 1st, 2020. And then we overlaid all of these different kind of events that had happened throughout that time. So we looked at things that were happening at the state level. So those are the words in blue. We looked at what we were doing at the local level. Those are the words in red. And then we plugged in holidays along there, and those are the boxes in yellow. And so as you kind of look at this timeline and look at the epi curve, you really can get a sense of what happened throughout our Pitkin County timeline, and really our sort of peaks and valleys with our epidemiology. So we can't say that these are necessarily causation, but there is correlation. As you can see, when the governor closed the ski resorts, we saw the epi curve start to go down. When we had the stay-at-home orders, we certainly really flattened the curve at that point in our community with mask orders. And in particular, you can see with the state mask order as well as the city and the county mask orders, there was some flattening or some decline around that. So what we know is that after holidays, we've traditionally seen a spike in the number of cases in the community and across the state as well. And so what we're trying to predict is, or not predict, but what we're trying to think about is, what do we know to be true when we have different holidays coming up, when we have events that might be coming up that might trigger higher rates of disease transmission? And to determine from that, how can we maybe have some different things, different mitigation strategies that we put in place to tamp down those spikes in disease transmission, knowing that what we've seen traditionally so far is that they certainly do happen after holidays, and we can implement strategies that can push those levels down without maybe going to really drastic measures like what the state dial pushes us into, which is really more policy decisions of around capacity, limiting capacity. Are there other kinds of mitigation strategies that we might be able to implement that might be less impactful to the community overall? And so, these are not things that, feel a little bit like it's very redundant messaging, but these are really still very important messaging. And I see oftentimes that some of these things aren't necessarily always being adhered to as tightly as they could be. And these are simple things. These are very simple things we can all do that allows us to reduce disease transmission and not have to get to those larger policy issues of in essence closing things or restricting capacity in certain sectors. So again, just a reminder of the 5 commitments to containment. The other, we've seen this is really to prevent outbreaks. And so there's been some data coming out of countries like Japan where they've seen super spreader outbreaks happening in relation to these three indicators. So people who are in closed spaces with poor ventilation, that they're in crowded places with many people nearby, and that they're close contact settings, so they might be really talking really closely to someone. And just because you're wearing a mask doesn't mean that you can talk really closely to someone. It doesn't mitigate for everything. So really keeping that social distance when you're chatting with someone. So avoiding the 3 C's is actually a campaign that other countries have used to really tamp down, again, outbreaks and super spreader events. So we really want to encourage folks to think about this. And then finally, participating in the virus in strategy. So as employers, how do you encourage your employees to stay home when they're symptomatic or sick? If they are symptomatic, to encourage them to go get tested, to participate in isolation and quarantine, to participate in contact tracing. This is the way we contain the virus. Testing alone will not contain the virus. We really have to do all 4 corners of the box it in strategy to get that virus contained and to prevent outbreaks or really large outbreaks. So the faster we can get all these pieces in place, and the faster that public health can do isolation and quarantine and really do that robust contact tracing, the better off we'll be to prevent the spread, the chains of transmission that might be happening from a particular person that had SARS-CoV-2 to begin with. So finally, I just want to leave you with a couple ideas for how do we really try to reduce those chains of transmission now, have advanced transmission control before we start to move into holiday seasons like Thanksgiving and having folks come to have skis on the mountain. We really, really want to tamp down the numbers now because of what we're seeing across the state and what we're seeing locally. Now's the time to really take action so that we can get to a Thanksgiving, because again, we know that we're probably going to see an uptick in cases after people come together for Thanksgiving and those kinds of events and activities. So these are just things that employers could consider as additional disease control methods for the next few weeks that we would like to encourage you to do voluntarily. Allow all non-critical workers to work remotely, provide additional paid time off so that workers will feel like they can stay home if they're sick and not come to work with symptoms. Doing on-site symptom screening rather than just maybe a symptom screening that they do at home and then come report to at work, but actually doing a verbal symptom screening or temperature check at work. Enforcing that workers are always wearing their mask properly when interacting with other individuals. Oftentimes I see someone might be wearing a mask, but they're not wearing it properly. So just making sure that employees are aware of what that looks like and how to go about doing that. Choosing to reduce service to increase social distancing. So that could be a choice that a retailer, or like if, for example, a restaurant might make, that they just reduce capacity to 25% voluntarily for a little bit to reduce opportunities for disease transmission. And then get creative in ways to increase social distancing within your own employer setting. So whatever ways you can really keep people from interacting closely together will actually also really reduce disease transmission. And then just reminding employees what they do out of work can also impact their work environment. So if they're choosing to have informal gatherings with a lot of people, not wearing masks, and not really thinking about how that could potentially impact their employer or their own employment if they come back and they're sick and they get their coworkers sick as well. So just want to encourage some thinking, creative thinking on that. But to remind everyone, now's the time to take action. If we take action now, we will be much better off when we start to see people coming inside, because it's as I'm watching the snow come down, that people are going to start to come inside more often. We're going to have the confluence of flu impacting the hospital setting. We're going to have holidays coming up, and we're going to have more people coming into our community. And so a combination of all of those things are just inevitably going to increase disease transmission and opportunities to get SARS-CoV-2 or COVID-19. And we really want to tamp that down now so that we can have a successful winter planning and successful winter season. Great. Thank you so much for taking the time to listen today. I really appreciate it. If you have any further questions for me, here is my contact information. And I really wish for all of us to have a really successful winter season. Thank you.